actually were doing a lot of stuff with what we call very baseline AI, because they used to put it into their systems. So they were interested in collecting data. So what they would do, when they build their system, they would build connectors. And those connectors would allow them to collect information, very quite rudimentary back then, that they would then use to do what? Build the next level product. You get what I'm saying? So they build the systems, and as they're using the systems, they're collecting that data, and that data is now telling them this is where the problems of this current system lies, based on the usability and what is happening. So when they go back into their R&D lab, they're literally taking all the knowledge of people using the system and how they're using the system and prompting to actually create new products. So it was quite cumbersome back then. But today, so if you think between 2004 and 2015, we had, someone get me a marker, please. We had what we call the growth of artificial intelligence was between 1 and 1 million%. Then from 2015 to 2019, we had a quadruple in growth in 4 years. 4 years. From 2020 to today, we have had almost 460% growth. And we predict in the next 3 years, we will have 1 million growth in. You see how far we're coming. I'm not trying to scare you, but I'm just trying to tell you the reality of the day, first of all. I put out a post yesterday on LinkedIn where I was talking to listen. The question is not, do you like it or not? And the question is not if you believe me. It doesn't really matter. And the question is if you want to do it, it doesn't matter either. The point is the price you pay when you're ready. Do you understand what I'm saying? It's about the price you will pay. Either you believe me today, I finish, and you move on. You don't believe me tomorrow, you do. It doesn't matter, because I haven't made the rules. It's moving at the speed of lightning. So it is the price that you will pay. Today you might pay $1, next year you pay $50. It's all down to you, but it's not going to change. Keep saying this thing, it's not going anywhere. And I talk to a lot of folks, they're like, oh, but we're living in Africa. You're living in a global world. You're no longer living in Africa. You're living in the global world. And in that global world that you live in, everything is connected. And people will sell you stuff because you actually haven't understood the power of what you actually do yourself. So, if we then fast forward into the Nigerian ecosystem itself, what I tried to do was, a lot of the problems with industries here, when we first about the impact of AI on the Nigerian insurance industry, before we get into the practicals, we really walk the journey. You see that I did an assessment of quite a number of private insurance companies, because I would say some of them are taking lead, and the two that I know them quite well, and I've done work with one of them, Actionable and Legal Insurance. Right? You all know AXA, right? They're probably the guys who, if someone asks me AI in Nigeria, I'll say, go to AXA. There's a couple things that they're doing that you probably will fall in love with as well. But when I first started, remember the first project I was doing was in 2019. And the problem was first getting them to understand data. Data. It was the biggest problem to get folks to understand the impact of data on AI, or the impact of data on usability. Are you following me? The impact of data on everything that you do. Today, we live in a world where data decide the decisions that you make. You still can decide to make emotional decisions, or you can decide to make decisions based out of logic, but the data is there. The data tells you what it tells you if you decide to follow the data. Hi, my name is John Kamara. I'm the founder for Afya Rekod and the AI Center of Excellence.
Tell us what this program is all about.
So today we are here in Abuja to provide a workshop and capacity program, which is part of the offerings that we do to the national state health insurance agencies across 36 states in Nigeria. 27 states are here represented, and basically looking at practical solutions of AI in state health insurance, especially around the areas of risk, fraud, identification management, and also using AI for intelligence and things like support as well. And really practicalizing the concept in, especially around data, how they use data from their organizations for predictive intelligence, being state agencies who also have to grapple with so many other issues. So if they can use the data they have to actually begin to solve some of the problems, it could go a fundamental way in actually helping them to really provide better service to their beneficiaries. So we're providing training for a lot of the IT teams. We already did a lot of the CEOs about 2 months ago in Johannesburg. Now we're working with the technical teams from 27 of the states, about 87 people here, really going through what their problems are, teaching them how to look at data, how to engineer data, how to clean their data, and how to use it for intelligence, but also how to develop tools inside their own current infrastructure. So a lot of capacity development, but very hands-on today here in Abuja.
Yeah, we have states, about 23 states are here. So what are the value addition this workshop will add to national insurance programs?
I think the key thing is, because we've been able to bring over, 25 states here, so we've brought most of the states in the country here, their technical leads, and also a lot of their program leads and their, revenue leads. It's really going to change the trajectory of how the states look at what they can do with their data. So one of the biggest value is using data for intelligence. As a country, we're preaching a lot about, becoming more data focused in our decision-making processes, but also using data to combat issues like fraud, risk, and assessment of beneficiaries. So combining the states means also we can start building a connective state framework for developing, collaborative intelligence for each of the states to support each other. So I think this is probably a significant, project across the whole continent. I've never seen a country where the state agencies have really come together to solve, two key problems of fraud and sharing data and knowledge together.
So at the end of the day, how do you think state governments will be able to apply themselves to the use of artificial intelligence to manage the insurance scheme? The health insurance scheme.
Talking to a lot of the state health insurance agencies here who've turned up, one of the key things that we've come to see is how do we apply AI into the systems we have. So, and that is sort of the practical exercises that we're going through today, but also giving them tools around visualization, data integration, data analytics, analyzing data in real time using simple prompt engineering mechanics on their own data. So by the time they leave here, they should be able to go back and say, hey, this is my data, this is what I'm going to do with it, and this is how I'm going to create intelligence, not just for me, for my CEO, for the government, for different agencies, and they start leading the fight into how to use data across different government agencies to actually drive intelligence, reduce costs, and provide better value for the beneficiaries.
What are those African countries and what are the templates you think Nigeria can use?
We've done it in Kenya, we've done it in South Africa, we've done it in Mozambique. We've done about 5-6 countries now, and it's growing across Africa. And we've also done it for a lot of C-level executives in a lot of those countries. And the idea is really around the PDI Institute, which is our core foundation, where we look at people, data, and infrastructure, and the role of AI across these 3 subsets that drive the transformational change. So really the goal is data transformation over digital transformation as a way for us to drive the value of AI in Africa and execute a lot of the revenue opportunities, but also cost saving opportunities and create more jobs for people. But I think one of the things that I want to add is the ability to develop capacity. One of the things we lack is capacity. So, one of the things that we push is building capacity, training people, on how to use these technologies, how to use these tools, and how to redesign their thinking to become more effective as we move into this new era of AI.
Okay, Dr. Dawal Kwandi Solomon, the Director of Operations and ICT at the Plateau State Contributory Healthcare Management Agency. So I work for the Plateau State Government, the Health Insurance Agency.
What is the value addition this workshop is going to add to the insurance scheme, health insurance scheme in Plateau State?
Okay. All right. So health insurance in Plateau State commenced operations about 5 years ago. And since then, we've actually been aggregating quite a lot of data. This actually includes biometric data, as well as some financial and health risk data of individuals. So we have continued to expand. The data that we have collected over time has become quite much, and they're actually also quite variable. So now, as the data continues to grow, and also as the health insurance industry continues to grow in our state, it means that we need to really get some elements of artificial intelligence, which will help us to pull this data together and make sense out of the data. Of course, so risks continue to change as we continue to operationalize the scheme, and we also continue to bring in people from different aspects of our economy, from the formal sector and informal sector. That means that we need a system that will help us to continuously analyze the risks of the people that we bring into the scheme, so as to enable the scheme become more sustainable. Because without integrating such elements, it becomes a situation where we begin to bring in people with adverse risks only, without integrating elements that will help us to mitigate some of these risks in terms of underwriting, determining what premium individuals will pay, also in terms of predicting utilization of healthcare services, as well as financial utilization, claims utilization, and the likes. So I'm very hopeful that with what we've started learning, it's going to be very, very essential and add significant value to the work that we do in terms of day-to-day analysis of risks, underwriting, financial predictions, healthcare service utilization. Of course, and overarchingly, this would help us to build and sustain a health insurance scheme, a social health insurance scheme that will continue to serve the people of Plateau State and overall improve the health outcomes of the people of the state.
My name is Dr. Emanuela Zamba, and I'm the Permanent Secretary CEO for the Lagos State Health Management Agency.
So how would this workshop, change the narrative of healthcare insurance program in Lagos? I know Lagos has, Afya Rekod, health policy.
Well, we've been at it for about 3.5 years now. We've grown quite significantly. I was listening to the differentials in the translations of difference between digital transformation and data transformation. We have done a lot in terms of digitalization, but we need to work on the data transformation, which I believe is what AI is going to position us to be able to do better. So how do we do what we're doing better? How do we use the massive data that we are sitting on to help us to improve what we are doing, and we can now plan even more futuristically. So that's why we're here, to take Afya Rekod to the next level and ensure that we are making the optimal use of the data that we have.
Okay. How do you share experience with other states? Because we're talking about national development.
Indeed.
Everyone should be involved.
So we have a forum. We meet quarterly. We share experiences. Quite a few states have come to visit Lagos, Kano, Adamawa, etc. Quite a few of them have come, and so we are very open to. That's one of the things, the reason why we set up the forum in the first place.
And so, what next after this program?
So we're here to gather information. We'll go back home and do a little bit of deep dive. We'll gather all the departments. I was very interested in the knowledge engine thing, how you can use your own data to ensure there's continuity and ensure that you're using your knowledge to grow, so to speak, and that you can even share that with other people. So we'll go back, internalize, look at it, and then we'll now come up with a plan of action, which we intend to launch very strongly in 2025 to see how AI can help Ilera Eco move to the next level.
So Lagos is going to launch
yes.
a pilot program on health insurance scheme
We
in
will.
2025.
We're looking. Yes, we're looking at that.
Absolutely. Thank you so much.
Thank you.
Yeah, my name is Emmanuel Akpofure. I'm the Director of Plan, Research, Statistics and ICT of the Delta State Contributory Health Commission, Delta State.
Okay. What is the program going to add value to your state health insurance scheme?
Well, I'm very, very optimistic about the program from the opening sessions that we've just had a while ago. AI, as we know, we use it, or I believe at the end of this workshop, we're going to have a more dynamic usage of AI to enhance data processing. Basically, it starts with data collection, health insurance. If you don't have the right data set, you'll just be rambling in the unknown waters, and that can be a lot of spice for fraudulent practices and so on in health insurance, which would mitigate, which would not enhance the success of the scheme in the state health insurance scheme.
Dr. Hassan Abdul Samad, Director of Programs from Katsina State Contributory Healthcare Management Agency. We've been implementing health insurance in the state since, I think, for the past 4 to 5 years. And we have made tremendous progress in terms of enrollment and other health insurance processes. Presently, we have enrolled close to 400,000 beneficiaries under the scheme in different aspects of the programs, be it the formal sector, the informal sector, the basic healthcare provision fund. And as we are also preparing to also enroll retirees under the scheme in the next 2 weeks. And when we saw the advert for this program, we felt so elated because we know the artificial intelligence is the moving trend, and the technology is fast moving, and we also don't want to be left behind. So, and that is why we subscribe into the program. And today's session has been quite enlightening, and as we see a lot of areas where we can make improvement in terms of fraud detection, claims management process, because we have one of the robust claims management process in the country. So we feel that this is also an opportunity for us to improve so that we can also diligently address some of the gaps that we have presently in terms of the claims management processing.
So my name is Dr. Jafar Mohammed Augi. I'm the Executive Secretary of the Kebbi State Contributory Healthcare Management Agency. We are happy to be here at this workshop on artificial intelligence and data mining organized by Afya Rekod and Adenian Labs. The relationship between the state agencies and Afya Rekod has not begun today. In fact, because for about 3 years now, we are going to Kenya, Rwanda, South Africa to attend important workshops organized by Afya Rekod. So Afya Rekod, I think they are making history in the development of state social health insurance in Nigeria. It is important that we have this workshop because enrollment is increasing by the day, and of course, managing data without automation is archaic and is virtually impossible. And that is why we have to bring our ICT staff, and of course, we come together with them also to increase our knowledge of the importance of data and artificial intelligence in the management of social health insurance, and that is why we are here.
Okay. I'm by name Yusuf Abu Abdul Karim. I'm Director General Sokoto State Healthcare Contributory Management Agency, SOKEMA.
So this program, what is it going to do for your Sokoto State Health Insurance scheme?
You know, as you have just asked about the importance of this AI training to the agency or to the health insurance industry cannot overemphasize because it's numerous. What I can tell you basically, as said by other or during the session, that we are much of interest in increasing the data that we currently have in the state social insurance agencies. So in data mining and artificial intelligence, this will like equip or give our staff more knowledge to have easiest way that we can be able to enroll our people, most especially like the state like where I came from, Sokoto State, where what we are trying to do, we are trying to bring the formal sector program by January 1st. All preparations are on the way to ensure smooth implementation of this program. And what is around the corner as at now is enrollment of the civil servant and their dependents. So in the enrollment process, we must have to be ensure that what we are enrolling and the data we are having is accurate. So this program is basically very, very important for delegation from Sokoto. That is why you can see that the Director ICT and the Director SQ of the agency are here with me in Abuja.